Hi, I'm Dr Rupert Suckling. I'm the Director of Public Health for Doncaster, and here's my final planned update for 2020. Of course, if there are any significant new developments over the festive period, then I will share these with you as soon as possible. First of all, I want to thank you all for everything that you've done since the start of this pandemic to support all of our efforts to tackle coronavirus, and also to thank you for the sacrifices you and your families have made. I appreciate it's not been easy and continues to be difficult, but it is as critical as ever, even more so to follow the guidance as we head into the Christmas and New Year period. We know this is not the Christmas so many of us had planned, and in public health terms, reducing the opportunities for the virus to spread is still critical. You will know that there's a new variant of the virus which has been largely focused in the southeast of England and Wales. We should not be complacent in thinking that it cannot reach Doncaster. It is more infectious as a variant and therefore has the ability to spread quicker in human-to-human contact. That's why it's important that we continue to follow the basics well, wash your hands thoroughly, keep your distance and cover your face. Staying local and avoiding travel is also going to be more important than ever if we want to avoid another spike of cases in Doncaster. I'd ask you to think about if you really need to make any journeys out of Doncaster in the coming days. I would ask you to also discourage anyone from outside the borough wanting to come and visit you. If you or anybody you live with has recently returned from a Tier 4 area, including Wales, I'd also strongly recommend that you avoid contact with anybody from other households, bearing in mind that in many instances of coronavirus, it can be present in people that don't show symptoms at all. Our infection rate for the last couple of weeks is yo-yoing and has been between 200 and 220 per 100,000. The rates today for the 10th to the 16th of December are 209.7 per 100,000, and the positivity rate, the numbers of people who have a test and test positive, is 9.5%. We do need to get this down and help ease the pressure on the NHS. It's worth remembering that our infection rate was as high as 580 per 100,000 in the autumn, and we have worked hard to get this down, and I'm sure that we can do this again. Doncaster's testing centres will be open over Christmas, so you can get a test and they are available. But please remember to self-isolate first if you have symptoms. We're currently working through the guidance for testing in schools, and we'll be supporting schools with the information in the new year. And as you can imagine, there's quite a lot of work to be done in the coming weeks. It was pleasing to see the first vaccinations in Doncaster care homes, which is good news. And as the vaccination programme continues to be rolled out nationally with more than 500,000 people, this is definitely a cause for hope and optimism. I'd also remind you to check reliable sources of information about the virus, including Public Health England and My Doncaster over the festive period, as there's a range of information, advice and helplines available. Finally, please do stay safe, and I hope you enjoy a healthy Christmas and New Year, and let's look forward to 2021. Thank you.